I'd like to take about 5 minutes to tell you about the Doc Access Act, why you should know about it, and how it could help you and the people you care about. Hi, I'm Dr. Matt Jones, and I'm a doctor of optometry with a small independent practice serving families in and around my home community of Blytheville, Arkansas for more than 20 years. I love what I do, and it brings me so much joy to be able to take care of the vision and eye health care needs of my community. From helping seniors stay independent and avoid falls, to keeping working age men and women healthy by providing some of the earliest detection of diabetes and other chronic conditions through eye exams, to helping ensure school-aged children have the tools they need to succeed in school and later in life. I really love what I do. But in recent years, I've seen a troubling trend, and it has me deeply worried about the future of healthcare in America. And it's this: insurers and plans that want to put themselves in the exam room with patients and are working against doctors and patients who believe their decisions are their own. That growing insurer and plan intrusion is creating higher costs, less doctor and patient control over important healthcare decisions, and is a significant threat to the access to care our communities need and deserve. Let me explain. Within the last decade or so, we've witnessed a period of rapid consolidation and vertical integration in many parts of our health system. One of the most well-known examples of these growing problems are those we see coming from pharmacy benefit managers, or PBMs. 85% of the PBM market is controlled by 3 dominant players. That's consolidation. And those PBMs are owned by health insurers that also employ pharmacists, operate retail pharmacies, and sometimes even manufacture drug therapies. And that's vertical integration. PBMs can have a significant impact on drug costs for patients, and their practices can result in an increased out-of-pocket expenses and limited access to certain medications. Policymakers on both the state and national levels are rightly focused on reforming abusive PBM practices with a goal of helping to lower drug costs and put control back into the hands of the patients and their providers. In fact, in my state of Arkansas, we just passed a first-of-its-kind law telling insurers that they can own a PBM or a retail pharmacy, but they cannot own both, because that's not fair. We must continue to fight back against harmful PBM tactics. But did you know that there is a market that is even more consolidated, more vertically integrated, and increasingly even more abusive to both patients and doctors? That's the Vision Benefit Manager, or VBM, market. Roughly 85% of people with vision insurance have that coverage through one of 2 dominant VBMs. In 42 states, a single VBM controls at least a majority of the market. And in 28 states, one VBM controls more than 75%. The top 2 VBMs are owned by larger companies that make nearly all eyeglass frames and lenses on the market. They own and operate most optical laboratories that produce finished prescription eyewear, and they are right now buying up independent eye care practices at an astonishing pace. The VBMs are even trying to link doctor reimbursement, not to quality care standards or metrics, but solely to how well the doctors do selling the products the VBM makes and services that they own and operate. VBMs also force doctors and patients to use optical laboratories owned or controlled by their parent company, which can mean even higher prices, longer than necessary wait times to get your glasses, and inferior production that can lead to remakes and even more waiting for your finished pair of glasses. Right now, you're probably thinking that it's crazy that your own vision insurance company is pushing you to buy the eyeglass frames and lenses that their parent company makes. Requiring you to use the optical laboratory that their parent company owns, is setting prices on the products that they make and sell, and so much more. You're right, it is crazy. That's why eye doctors are working closely with policymakers and leading national patient advocacy groups like Patients Rising to fight back and put some control back into the hands of patients and their doctors. We're telling Congress to pass U.S. House legislation called the Doc Access Act and Senate legislation called the Vision Lab Choice Act that aims to take control back from the VBMs that think they can force patients and doctors to always do things their way. The legislation would tell VBMs that they can't set prices on goods and services that are not covered under the plan, that they cannot force doctors and patients to use optical labs that they own and operate, and it would put a stop to never-ending, lopsided VBM doctor contracts that enable their abusive behavior. Tell your lawmakers that it's time to give control of important healthcare decisions back to patients and their doctors. Together, we can help bring some sanity back into our healthcare system by kicking the insurance executives out of the exam room.